I would like to warmly welcome you to our second annual Women in Medicine and Science Professional Development Conference. My name is Vidya Prakash. I'm an associate professor here, infectious disease physician, and proud director of the Alliance for Women in Medicine and Science, also known as AWIMS. AWIMS's mission is to provide a supportive forum to promote honest discussion and positive change in the realms of gender equity, career advancement, work-life balance, community service, and to champion professional development and promotion of women in medicine and science. We were very deliberate with the term alliance because it truly is an alliance of all members of our SIU community, and it warms my heart to see such a diverse crowd here. So a round of applause for all of you for being here with us today. AWIMS would not be what it is today without our amazing advisory board and executive committee. Would all members of either of those committees please stand to be recognized? AWIMS is under the Office of Equity, Diversity, and Inclusion, under the auspices of my mentor, confidant, and guide, Dr. Wendy Elamine. Dr. Elamine, please stand up. So today, we are gathered to address the incredibly important and timely topic of wellness. Our planning committee recognized the importance of elevating the discussion to topics beyond burnout, topics such as resilience, coaching, nutrition, and overall wellness as it relates to the essential continuum of the body, mind, and spirit. My heartfelt thanks to Dr. Charlene Dewey from Vanderbilt University School of Medicine and to Dr. Kerri Palamara from Harvard Medical School for making a special trip to SIU to share their invaluable expertise and wisdom. We would also not be here without the tremendous support of our sponsors, our gold sponsors, the Departments of Medicine, Surgery, the Neuroscience Institute, Family and Community Medicine, Pediatrics, Obstetrics and Gynecology, and our bronze sponsors, the Departments of Population Science and Policy, and the Department of Medical Education. I am indebted to the members of my planning committee, and they include Dr. Hilary Sanfi, who is actually the visionary behind this event when we started it a year ago, Dr. Wendy Elamine, who you've already been introduced to, Dr. Susan Hingle, Dr. Stacy Sattovia, Ms. Laura Warhol, and Dr. Vidya Sundareshan. Also, many thanks to Ms. Judy Harbison of the Office of Continuing Professional Development, Ms. Leslie Barfield from the Office of Equity, Diversity, and Inclusion, and Ms. Linda Kelly, who's been invaluable here at the MCLI. Also, many thanks to our invited guests, Dr. Leslie Smith, Dr. Christine Todd. We have a massage therapist who will be here between 11:15 and 1:15 to give chair massages in the back of the room, Ms. Sachin Simeon. Ms. Emily Krause, who's a yoga instructor who will be taking us through chair yoga later today. And we have our two artists who most of you should have met already. I'm going to have them stand, Ms. Marianne Stremsturfer and Dr. Patricia Braun from the Springfield Art Association. I'm going to have them just take a minute before I introduce Dr. Cruz to give you a brief instruction on the art project that they're going to be making. So Marianne, if you could address the group. She's right here.
Okay. Good morning.
Thank you, Marianne. I would also like to draw your attention to all of the posters that will be showcased. They're representative of a key part of our research efforts, which are led by Dr. Hyung Han and Ms. Stacy Grundy. Hyung, she's one of my co-chairs for the research subcommittee. So thank you, Dr. Han, and to Ms. Grundy for all of your efforts. So now I'm going to hand the mic over to somebody that I greatly look up to and admire, our dean, Dr. Jerry Cruz, who has been an incredible source of support for this conference and particularly for AWIMS. He is our greatest cheerleader and supporter, and we are really indebted to him. So it is an honor and a privilege to welcome Dr. Cruz to the stage now.
Good morning. That's another good response. It's great to see everybody here. Thank you so much, Vidya, for the introduction. This is a really big day for the SIU School of Medicine. the Women in Medicine and Science Professional Development Conference is a highlight of the year for us. These kind of meetings actually tend to be celebrations for us. There are ways in which we can get together to learn, but they're also important ways in which we change our organization. And that's what all of you are doing today. So it's a big day like many of the other big days that we have. Match day is a big day. It happens right here. The white coat ceremony is a big day. Now, well, where did Leslie Smith go, as a matter of fact? Leslie, she was carrying crock pots around. What? Leslie is wearing a white coat that's bringing new meaning to the white coat ceremony. Her white coat says chef on the arm. But again, that's part of this. Old symbols getting new meaning and put in new contexts that are very important. Also in this room, in the last couple of months, we had investitures for endowed professorships, endowed lectures like the Kinnebrew Lecture, changes the organization. Our 50th anniversary is next year, and we'll have a lot of celebrations like that, where we will be intentional about the things that we do. But one day that was really big, just a few weeks ago, was our graduation. And we have a lot of graduations from residency programs and from a variety of programs. But the one from the School of Medicine was a big one this year that I think is relevant to this conference. And it's relevant because our alumna of the year, a graduate of the SIU School of Medicine, and our graduation speaker was Dr. Senait Fassah. Now, she graduated from SIU School of Medicine about 20 years ago. She's from Addis Ababa, Ethiopia. She was actually raised in a family of 11 children, and with parents and siblings who actually had a conscious effort to develop in a way that they might change the world. She came to Illinois when she was 18, went to Dominican University. Well, actually, it was Rosary College then, now Dominican University in River Forest, Illinois, and then spent a stint at the University of Michigan, all the while thinking about how could she improve women's health and advance women's rights. So she was accepted into our joint program, MD-JD program at the SIU School of Medicine. After that, she did a residency in obstetrics and gynecology at the University of Michigan. She stayed for a fellowship in reproductive endocrinology and infertility. She stayed on faculty and had a meteoric rise to a professor with tenure there, and became the chief of reproductive endocrinology there. She was the founding director of the Center for Reproductive Medicine at University of Michigan and the founding director of the Center for Reproductive Health Education there, through which she established OBGYN training programs, residencies in Ethiopia, the first curriculum-based residencies in OBGYN in that nation. All the things that she did didn't go unrecognized at all. In 2015, she was named the Director for International Programs for the Susan T. Buffett Foundation in Omaha. And then in 2016 and 2017, she headed the election campaign for Tedros Adhanom, who became the first African Director General of the World Health Organization. And she now functions as his chief advisor, while continuing to wear all those other hats, that I mentioned. She's really, really, really amazing. And, but as I was preparing for the graduation, I watched some tapes of talks that she'd given. And I just want to read the last paragraph of my introduction at that graduation. All along, Dr. Fassah has been an advocate for reproductive health, reproductive rights, and gender equity. Indeed, she has become one of the world's great advocates for women in all aspects of their lives. Her activities inspire, uplift, and support women and unleash their potential. She builds programs to dig deeply into communities to find talented women, to cultivate their innate skills, and to elevate them and give them a platform. She knows that investment in the lives and education of girls has a tremendous return on investment for society. So just take a look at the posters and listen to this. Build programs to dig deeply into communities to find talented women, to cultivate their innate skills, to elevate them and give them a platform. The platform is important, the voice, for sure. Now, the other thing is, the graduation was a red letter day for the SIU School of Medicine because we made a big change. For the first time in the history of the school, we switched from the Hippocratic Oath to the Declaration of Geneva. And Dr. Fasaha, off the cuff, actually referred to that oath, which can be taken by any member of the health professions. And I'm going to read that to you right now and listen to it in the context of the bigger picture. As a member of a healing profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good practice. I will foster the honor and noble traditions of the medical profession. I will give my teachers, colleagues, students the respect and gratitude that is their due. I will share my knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights, civil liberties, even under threat. And I make these promises freely upon my honor. She emphasized, obviously, I will attend to my own health, well-being, and abilities in order to provide care of the highest standard, and gave that message to our graduating medical students. And that's what you're here today all about wellness. I will say a couple of things in the program that really caught my eye. The first one was the number of times that resilience came along. And being resilient means that you actually have to prepare for things that are difficult, and then you have to be able to rebound from those things. With our patients, oftentimes we really emphasize making a diagnosis and getting treatment for a disease. But if we paid more attention to the things that happened before and improving the function after, we probably would have a better continuum of medical education, and it's the same thing for healthcare providers as well. The other thing that popped out at me when I looked at some of the presentations was the importance of being grateful and thankful. That attitude actually moves us really forward, and I'm glad that that's part of this conference as well. So I will just say in summary that this organization, the Alliance for Women in Medicine in Science, a dedicated group for the things that you do for women and advancing women and moving things forward. I can't say how important it is to the organization. It's astoundingly important. It helps us become a more inclusive place. It helps us become a more welcoming place. It helps us all not to be lonely. But beyond that, and the most important thing, is it changes the organization and takes us places that we sorely need to be. So thank you for doing that, and thank you for being here. And I wish you the best on this beautiful day. You're doing great work. Thanks so much.
Thank you for that wonderful and inspiring introduction, Dr. Cruz. So I'm going to introduce our speaker for our first plenary, Dr. Charlene Dewey, who will be presenting It's Not Just Me, an organizational approach to reducing burnout and enhancing resilience. So this is Dr. Dewey's second time in Springfield. She was so popular for last year's conference that we begged her to come back again. So Dr. Dewey is an internist and graduate of Morehouse School of Medicine. She received the Ciba Geigy Award for Academic and Community Leadership and the Departments of Medicine and Psychiatry Achievement Awards. She completed her residency and chief residency at the Albert Einstein College of Medicine, Montefiore Medical Center, after which she joined faculty at the Baylor College of Medicine in Houston, Texas, as a T.T. Chow Scholar. Dr. Dewey received her medical education, master's in education and curriculum design and evaluation from the University of Houston, and developed 2 model programs there, the Educator Development Program and Residents as Teachers and Leaders Program. She joined Vanderbilt University School of Medicine with joint appointments in the Department of Medical Education and Administration Office of Health Sciences Education and the Department of Medicine Division of General Internal Medicine and Public Health, and she has been there since 2007. Dr. Dewey is a full professor, assistant dean for educator development, and co-director for the Center for Professional Health. She's also chair of the Faculty Wellness Committee and past chair of the University Faculty Senate at Vanderbilt University. Dr. Dewey is an expert and highly sought-after educator in not only prescribing opioids, but also in professional health and wellness of the healthcare provider. She's also been recognized with numerous awards for her contributions to teaching patient care and community service. She's a member of Vanderbilt University School of Medicine's Academy for Excellence in Education, the YWCA Academy for Women of Achievement, and winner of the 2013 Athena International Award. She was honored by Bradley University with the Distinguished Alumni Award and the Bradley University Orville Nodorft Lifetime Achievement Award. She has 2 named scholarships in her honor and is a 2-time recipient of the Vanderbilt 5-Star Award for 100% patient satisfaction. Before I invite her onto stage, because if you say something enough times, it'll happen, Dr. Dewey will be leaving Vanderbilt University and joining us at SIU School of Medicine, right? Dr. Palamara, you're next. Without further ado, Dr. Dewey.
That's wonderful. God bless you. You're so great. Thank you and good morning. I'm so excited to be back again. I love you guys. And so who knows, maybe in a couple years I might just be here. So I'm going to jump in because my presentation is titled, It's Not Just Me, An Organizational Approach to Reducing Burnout and Enhancing Resilience. And I just want to know, how many of you were here last year? Raise your hand. Woohoo! All right, wonderful. But that means we have a lot of new people in the room. And so I'm glad that I kind of did this the way I did because I put a little bit of a snippet from last year back in, but it's a little bit, okay? All right, so I always make sure that I report that I have no conflicts of interest to disclose. And this session, really, the overall purpose is to encourage reflection. So I want you to kind of think about things. Think. About you as an individual, about this organization, whether you're going to think about your department or the little office that you might be in or the big picture, okay? But think about those things. And then we're going to talk about how we might be able to reduce and prevent burnout while creating a culture of wellness, because that's what we really want to do. And both Vidya and Jerry mentioned this a little bit about this culture. And so I like talking about how we as individuals create our own cultures. So for your learning objectives, I expect that you should be able to discuss at least 5 different conceptual models related to professional health and wellness in the workplace, list and discuss Maslach's 6 sources of burnout, and then compare and contrast individual and organizational solutions that reduce sources of burnout and enhances this culture of wellness. So in our brief introduction, I'm going to go over the conceptual models and then the burnout and the Maslach sources. That's the small part. The big part is what we're going to spend most of the time on, which is the individual and organizational approaches. And then if you don't have this sheet, okay, then if you have a piece of paper or something, this is going to be on your jump drive, I'm assuming, because everything should be on the jump drive. And this is a little bit of a worksheet that we developed at Vanderbilt to kind of make you start thinking, again, individual, organization. What am I going to do one way or the other? So I like when people write things down. So as I'm talking, if you don't even have this piece of paper, that's fine. Get a note sheet or a blank piece of paper and just jot down some things as we go along, whatever comes to your mind. And ideas are going to come as well as challenges, but write them all down so that this way when you're finished, you can then think in your area, your office, your department, your division, whatever. What am I going to do differently? How are we going to do things differently? Is that good? Everybody with me? Okay. Everybody have a pen? I want everybody writing. Perfect. And then we'll do a summary at the end, okay? All right, so just so you know, this is a little bit of that background that 30 to 60% of physicians and other people have burnout in the organization. And it ranges from physicians as well as nurses, medical students, as well as residents and fellows, okay? And we know that those increase depending on where we're looking. But department specific, we have burnout in the OR just as much as we have burnout in different clinical settings. Certain types of specialties might be a little bit more, like emergency medicine, OBGYN, okay, internal medicine, family practice, neurologists, okay, and even anesthesiology. So burnout doesn't discriminate. Burnout can hit our scientists in the lab as well as our nurses in the hospital or in the clinic. And it's across all the places. If you look now, the information coming out on burnout is not just in the United States, it's all around the country, all around the world. So burnout is this problem that affects a lot of people in healthcare. We have 43 million healthcare providers in the world, okay? And so if we even take 30% of them as being burnout, that's a lot of people. And so we have to start finding ways to reduce this as a problem. So this is one of the quotes from my mentor, Andy Spickert, who's at Vanderbilt and is retired. I took his place. And he wrote an article in 2002 that said the seeds of burnout may be sown in medical school and residency training where fatigue and emotional exhaustion are often the norm. And we still find that a lot as we go through training, whether you're going through nursing or your PhD. When we start in training, there's a culture that we walk into. And that culture, again, is what kind of dictates how much we might be exposed to sources of burnout. Anybody here never experienced stress? Raise your hand. All right, so stress is inevitable, but burnout doesn't have to be inevitable, okay? There are things that we can do to early recognize risk for burnout and address it. Mental health is one of those things that's also common, and we in the healthcare professionals are really no different than all of the other people in the world. When you look at the rates of depression or anxiety, we parallel the general population. So it's important for us to recognize that we bring those things in with us as well. And then impairment is one of those things that's unfortunate that happens for many of us in healthcare, and we want to be able to find where those risks are. And again, it doesn't mean that we can't do something about it. The bulk of my job is really finding the people at burnout or impairment and pulling them back into a good place. Unfortunately, physician suicide is pretty significant. I don't think I know the exact rate for nurses, and scientists, the data has never been studied or published that I know of. But when I talk to my scientists, they all tell me that it happens, okay? And I know it happens. We just don't have as clear evidence about it that we have on the physician side. We also know that burnout has significant financial costs. There's reduced productivity, either patient care-wise or academic-wise. There are increased legal risks when someone is burnt out because of patient safety and quality issues. And there's distress behaviors and poor team function that also start to come out. And I'm going to bring this example in one of the cases that we're going to do toward the end. And then, of course, the cost for replacement. To replace someone, if one of our nurses or scientists or a physician gets burned out, then they leave medicine for whatever reason, okay, even if it's temporary or long-term, then to replace that individual is also significant costs to the institution and to the departments. And then, of course, what about burnout? What about reputation? When we find out that some people are distressed or they have, as we call the bad behaviors, that starts to impact reputation. And then what we are seeing outside of our institution then starts to display another message. So these are all the costs that are associated with burnout. The other important thing is this: where does the workplace environment come in? This notion that we are individuals, but we work within a workplace. And so this was a study done quite some time ago, but What they really did is they looked at the work environment. And it's clear that work environment actually influences your overall satisfaction. And then when you have work satisfaction, you're generally happier and more engaged in your work. But when your work environment is reduced because of infighting or different issues that go on, even just one individual can do this, then your satisfaction goes down. And Shanafelt and that team actually recognized that when you have 1 point higher in burnout and 1 point lower in satisfaction, then your risk of leaving the healthcare field goes up. Okay, so there's a direct relationship, and that's why it's not just about you. It is about you and your organization. Okay. So now I'm going to go into a couple of those conceptual models. And again, I want you to think and write down a few things as I talk about them, how they might apply to you as an individual and you within your organization. So here's one of my favorite quotes. I think I say this at almost every presentation that I give, which is, the medical academy's primary ethical imperative may be to care for others, but this imperative is meaningless if it is divorced from the imperative to care for oneself. And how can we hope to care for others, after all, if we ourselves are crippled with ill health, burnout, and resentment? And then it goes on to say, if they are to heed the self-care imperative, medical academics must turn to an ethics that not only encourages, but actually demands care of self. And I love that because I kind of like to go around and empower people to demand care of self. And that should be the standard, right? That should be the standard. All right, so my first model was developed by Stern, and he looked at professionalism. And so we all come to work, and we're all supposed to be professional when we come to work. And it says that it's built on clinical competence, communication skills, ethical and legal understanding, with these 4 pillars of excellence, humanism, accountability, and altruism. And that together makes up professionalism. But what we all know is that human behavior is at the root of all of this. And so the professional health and wellness of the individual directly reflects their ability to perform professionally in all of these realms. And then the whole professional culture of which you circulate in also has very strong impacts on that behavior. This is one we developed at Vanderbilt, which looks at wellness on this spectrum. And so you can see on this side, okay, is where someone is completely healthy and well. That's when we say they have complete vitality, they're engaged, they're satisfied, they're doing all those wonderful things that they love coming to work to do. But then there's that phase of stress, followed by the phase of burnout, and then lastly, the phase of impairment. And that impairment is for different reasons, but mental health and things like that are certainly there, as well as the risk of suicide. And what you might see, these little swirly things that I have here, is that people can swirl inside these phases for quite some time. And it's very interesting that a lot of people really don't know that they're swirling in the burnout phase. And that's why awareness becomes really important. But the behaviors that can be demonstrated through stress, burnout, and impairment are those that we call behaviors that undermine a culture of safety. And so we like looking at this zone of opportunity where we have behaviors that we can promote and or manage and or change quickly in order to promote that culture of wellness. This one we developed quite some time ago as well, and you can see, again, it has this dichotomy of the individual versus the organization. And so the top bar is when the individual is healthy and well and functioning well, and the organizational side is nurturing and functioning, then what we have is institutional and individual vitality. However, if you come down to the bottom part, in the red zones, when the individual is not at their best and the organization is dysfunctional, then we have what we call is the perfect storm. And that's where we want to kind of keep people from getting. But again, it's individual and organization. That model was actually just recently revised, expanded on by the National Academies of Medicine in 2018, and they gave these little breakdowns. So on the individual side, it's their healthcare role, their personal factors as well as their skills and abilities. And then on the organizational side, or the gold part over here, it's their social cultural factors, the regulatory, business, payer environment, organizational factors, learning and practice environment. So now it defines out what all of those little pieces are on the both sides of that dichotomy. And this is just to show you, not because you're going to read it, but just to show the list of all of the things that they included, both on the individual side as well as on the external or organizational side. So you can see it's significant. Okay. All right, and then this is the last one that I'll show, which is the 9 Steps of Creating Joy in Medicine by the American Medical Association. And they divided us a little bit differently, but I like some of the things that they included. So in the culture of wellness, it's that part of engaging leadership, tracking business cases, resources, infrastructure, things like that. And the efficiency of practice. So when you're coming to work, does the organization support things that allow you to do your job in the best way you can, in the most efficient way that you can? And then again, this part around the personal resilience, which in my breakout session we'll talk a little bit more about. So that's just my little bit of introduction in the background of how those models are going to play into what I'm going to talk about coming up. So any quick questions on that? Okay, I will tell you there are more models. Okay, I limited it to 5, but there are some other ones that I think are really important that maybe somewhere down the line on my next turn here, we'll get into some of those other ones. Okay, so here's my little snippet amount on burnout. All right, this is for anyone who's not heard presentations on burnout to make sure we give you some knowledge and some potential for self-awareness. I love Christina Maslach. I worked with her a little bit, and so I use a lot of her content. And her real important piece about burnout, again, is it's not about you, right? It's about both you and the individual and the organization, because she describes it as a mismatch. A mismatch between the nature of the job and the nature of the individual who does the job. And again, that then doesn't put blame really on anyone per se. It's about a mismatch. And that's why I like that definition, because some people tend to say, oh, well, if you're burnt out, it's your fault. Well, no, it is not, okay? But she outlines these 6 sources. So I want you to think, again, in your reflective cap, which of these sources might you experience? Work overload? Anyone? Anyone? Okay. Lack of control? Anyone? Anybody who's not in the CEO position, right? And even they have lack of control over certain things. I mean, they still have regulatory things they have to manage. Insufficient reward, gender inequity in pay scale. Anybody? Anybody? All right. Unfairness, same kind of things. Breakdown in community. This is one of those where your work environment is significant, where even individuals within the work environment have infighting or significant disagreements about how things should be done, and it can almost be a toxic kind of place. But we as human beings love relationships, and when our relationships and community are not right, then we will also be at risk of burnout. And then value conflict. And I'm going to give an example of value conflict, and what's said here stays here, right? Right? All right. When I went into medicine to serve poor people. And I got my dream job at Baylor College of Medicine working in the Harris County Hospital District, where I took care of the poorest of the poor people. And I don't ever remember going to work not feeling excited, like, wow, I'm making a difference, I'm doing something here. I did home visits, I changed people's toilets, okay? That's what I wanted to do in medicine. When I moved to Vanderbilt, they don't have that. My whole being and purpose of being as a physician no longer existed. And so that is an example of value conflict, okay? And that led to, I think, my 2nd level of burnout, okay? So just reflect on those, and if you think you have any of those. Now, what if you're at burnout and you don't really know it? Here's what it's going to look like. This chronic emotional exhaustion, that's where I say you need that T-shirt that has the neuron on it and it says, I've got one last nerve and you're yanking it, okay? That's when you know you're at burnout. You just can't handle one more thing. And I keep this in my mind, because every time I kind of almost get to that point, I'm like, I just can't do one more thing. You know you might be heading in that direction. The cynical and detachment part is that place where you start to separate. And it's you versus your department, you versus other people, you versus SIU. And if you're in that realm, then you might be heading toward burnout as well. And then the last one is when you become increasingly ineffective at your work. So the individual who doesn't necessarily want to get to that meeting on time. They purposely do other things not to get there on time. They are 100, 200, 300 charts behind because they just can't find the strength to get back into the EMR, okay? And their productivity starts to go down, all right? So when you get to that point, that's when you know you might be at risk of burnout. And what that leads to is reduced quality of care for our patients, professional isolation and avoidance, as well as interpersonal conflicts that start to bubble up. And then we start saying, I don't want to be around you, you don't want to be around me, but we don't know why, okay? I've been doing a lot about studying conversations and the way conversations go. And I can look at conversations now in a totally different way. And when people say things, what do they actually mean when they say certain things? And you have to start picking up on those clues, and that's when you see them start to get that cynical and detachment part. And then, of course, it leads to turnover, and the consequences aren't just to that individual, it's to those around them. And that's why it's so important for us to think about how do we address this problem, reduce these sources of burnout, both as an individual, because everything is personal to you. My reason for value conflict might not be the same reasons as Sue's values conflict issues, okay? And so that's why it becomes very individualized. When I work with somebody with burnout, this is so personalized. Talk about personalized medicine. It's personalized burnout care, because you can't just assume that one thing from one person to the next person is going to be the same. And that person has to look at how they're going to deal with their sources differently than another. But it is impactful to the whole organization, and what's going on in each organization is going to be different. You know, you've seen one organization, right? Okay. Any questions on burnout before I move on? Okay. All right. So then I'm going to move on to looking at who's accountable and what do we do about it as an individual in an organization. And this is part of a talk that I gave at Amy just over a year ago, looking at the individual all the way up to the global level. So Maslach herself also described that the way to address burnout is both through individual and organizational approaches. So on this side, we have the individual. That's somebody who's working down in the trenches, sees the problem, understands what could potentially be needed to do, rally some other people, just like Vidya is doing in this group, and Wendy and everybody, from an individual side, okay? It doesn't mean it's one person, but it might be one person who identifies it, and then groups of people come together and they work on it, versus the organizational side, which we tend to think of the top-down approach, in which maybe the leadership. So you guys have Jerry here, which is great and wonderful because he's very supportive, okay? And what he sees from his 20,000-foot level, and what from an organizational approach. When he gave money, when he supported Wendy's hiring, when he gave money for Vidya to have this program, okay, and for Hillary to think of this kind of an activity and there's money behind it, that's an organizational side. Okay, so it's more top down. So that's the premise of what I'm going to talk about. So on the individual accountability side, can we say that it's not anything that the individual has to do? No, of course not. There are things that we need to do as individuals. So the first one is, what about self-improvement? For the physicians in the room, how many of you are master trained on your EMR? One person. Okay, so you have a job, okay, because you've got to train whoever else are the rest of the physicians that are not masters, right? So that's the one thing I think about. If we have frustrations and issues with our EMR, Are we masters in it? How can we become better? And then how do we direct our own self-improvement? In the individual workplace solutions, for example, when we moved into our new clinic, one of the first things I noticed being in the office is that they put the otoscope and stuff on the wrong wall. So every time I have to take it to look at a patient, I'm like giving them a strangle job. So from that, I go immediately to my clinic supervisors and my nurse leaders and say, how do we get this changed? Okay? And then the last one down here is invest in individual workplace culture solutions. And so that's, again, that part of the culture, the right people on the right seat on the right bus. So that's out of Jim Collins' books, which I love the model for that. But when my tech brings a patient back to my office, she knows exactly what she's doing. She's efficient on the EMR. She hands that patient off. I can handle that patient. I hand it off to my nurse. My nurse knows exactly what she's doing. Okay, and our team is flowing like a beautiful river. Okay, and the patient has no upsets through it. Those are those kind of systems that you want to develop. And so that means we need culture solutions that help make sure everybody feels they're doing exactly what they came to work to do. And those can all be individually. Then on the organizational side, let's think about that culture of safety again. Okay? Do you feel safe in your work environment? Safe to talk up? Safe to bring up issues that we just talked about on the individual side? Who's the people that you go to? What about wellness? You guys have this program here. What else goes on in your individual units? Okay. Workflow. Again, this is a little bit of a bad example, so don't go telling people at Vanderbilt. But when we switched over to our EMR, we had one homegrown EMR, and then we had to change to Epic. And they gave us some web-based modules, and I was like, okay, this isn't bad. I'm excited to kind of get in and start working in Epic and seeing how it goes. Well, then they have this one training session, which was about 2 hours long, and it didn't make any sense. It was kind of all scattered. And my first thought is, where is so-and-so, who's the head of this? I've got to go fix this, right? Because the training just wasn't good enough to get us ready to go into clinic, all right? And so there's a part of where mastery comes in, and how do we make sure people feel masterful? And so when we get to that workflow, where are the problems? Studer is a good place for this. If you read any of their books, they go in and they do these assessments where you go into each work environment and you look at the flow and where are the problems occurring, and then find teams that work together in order to fix those flows. But those can all come down from the top. Financial, again, that one, again, makes sense, right? Because it's putting the money where the mouth is and making sure that there's enough. Anybody use scribes? No one, okay. I like the idea of scribes, okay, but that means somebody's got to pay for the scribe, right? And if you have after-hour clinics, well, who's staying in the after-hour clinics? Are we hiring new people to stay in the after-hour clinics? Are we shifting morning? And so financial backing has to go with it to make some of these changes. And then, of course, organizational policy. So, Sue, do we have a mission statement of wellness here at SIU?
Not yet.
Okay. So we're going to work on it, right? We are. All right. Okay. So we're working on that, but where's the policy that says everybody has the right to demand self-care in one way, shape, or another? And again, this can usually be done at the higher organizational levels, but we, down at the individual level, can also influence that process, okay? So are you writing down any ideas here? Are you getting ideas? Are you thinking about some of these things? Okay. All right. Then nationally, anybody on any of the national areas for your role? Nursing, physicians, okay, scientists. Okay, so up and even in the national, organizational, global, big state regions, there are still things that they can do. So there are oversight programs that they can implement. Opioids, one of my favorite topics, and that's where we start to see things change. When the state says it, right, then we all do it, right? So Recommendations for leaders. How many of our leaders are actually trained in helping individuals prevent burnout? Not a whole lot, okay? But from a state, a national, or a global level, there could be policies and ways to assure that they get trained in this. And then there could be state, national, global metrics, okay? Sue, I know, is working on an article with a colleague, okay, for a while to figure out how do we get metrics involved. Not because we want to say, oh, this school's worse than this school, but because we want to be able to say, here's where you are, how can you move forward, okay? And then there's specialty recommendations. So what does the AAN say that's different than pediatrics, that's different than the Nursing Association, that's different than the Scientists Associations? Okay, and what are those things that they can do from, again, the higher leadership level? So if you're on any of those committees, then this is a voice that you can bring to help influence those cultures. All right. So then I'll put this little matrix together that takes all of those from the individual and the organizational side. And you can see self-care, I put 3 X's by because that's really strong on the individual side versus something like oversight of specialty recommendations, which would be much heavier on the national side. But every part of this has a role somewhere, all right? And so again, that's why we go back to the title. It's not just you, okay? It has to be a much bigger picture. All right, so going back to this individual and organizational approach, this is what this little worksheet does. So if you have your slides or if you have a blank piece of paper, I want you to just, as we go through this next case, I want you to write down those sources that you think this person is demonstrating, okay? All right. Okay, so this, I used a physician case because I'm a physician, it was easy to do. But you can also think if you're a scientist, this is your lab, okay? If you're a nurse, this could be your unit that you work on, all right? But you'll see the characters probably exist in your world just this easily. So this is Dr. XYZ, and she's a 55-year-old physician, and she's really passionate about her patient care. However, she loses it when the day is not smooth. If things don't go right, her level of, we'll say, energy changes in a very not so nice way. Her nurse and she are not getting along at all because of some of these behaviors. The nurse is actually avoiding her and is pretty embarrassed when she has some of these emotional and or aggressive behaviors in the clinic. She's worse on days that students and residents are there because she says they're stupid, they slow her down, it messes up her Press-Ganey scale, lots of things that people might say when we're in an academic environment. And so she also has pretty poor teaching evaluations. In confidence, she actually tells you that she and her spouse are divorcing. She actually had an extramarital affair with a colleague. She's heard yelling a lot about medicine. It's becoming a factory. The whole system sucks. Leaders are always pushing productivity, but never giving us the money or the means in order to get things done. All right, and pretty much her MA quit 4 months ago and hasn't been replaced yet. 4 months, okay? When she goes home, she's not really present at home. She's spending up to 3 hours at home working on charts and doing paperwork. And she, of course, knows that these are due to the inefficiencies of her clinic. She's pretty stressed. She drinks a couple of beers while she's charting to kind of keep her anxiety down. And she feels a little bit trapped. She can't really leave just yet because she has 2 children that are college age, and she knows that she's going to need money for tuition. Okay? So, do you see any problems in this case? And I can tell you, when we look at these individuals, you know, I automatically look at all of these and just start picking out behaviors that are because of her burnout and or maybe impairment, okay? And that's what we need to do, look at people as what the behaviors are, not as the individual being a bad person, okay? Because all of this we can fix. It seems like it's a lot, but we can fix all of these things. So, Now let's look at it from the internal and the external side. What sources of burnout did she demonstrate or experience? Talk louder. No, there were two at the same time. She loses it. So what do we think that might be? Where would she be on the spectrum? Stressed at minimum, right? Maybe burnt out, maybe impaired, but definitely stress. Okay, and losing it might be why? What were the clues inside the case? Lack of coping. Lack of the administrative help. The MA is still not hired yet. Work overload, because she's never stopping work, right? She's just continuing work all through the evening. No breaks, no downtime. What else? Right. So she's in an environment that doesn't have good community, right? And so there's breakdown in community. Stress at home, okay, which can be huge, right? And again, especially relationship challenges, divorce, those are big triggers, okay, for putting people at risk for depression as well as suicide, okay? Anything else? Value conflict, why? Exactly. And she's passionate about patient care, right? So when she's passionate about patient care, but the system doesn't work well and there's all these hiccups going on, it's almost like a personal assault to her because she can't make things do what she needs it to do for her patients. Okay? Anything else? So that's total lack of control, right? She feels trapped. She can't leave. She can't hire the MA herself. It's an organizational thing. Okay, she can't change every little thing in the clinic. Why are they still giving her medical students and residents? Okay, right? When she doesn't like the teaching part, right? So there's a total lack of control going on for her, okay? And so that's why she ends up having pretty much every level of sources of burnout that actually exists. And so then what we need to think about, again, this is why I say dealing with the burnout is huge, but it's individualized, because then we have to look at what solutions can we do for her. So we can give her personal coaching that Kerri's going to talk about later on. Maybe she also needs mental health counseling if she's depressed or if she's using alcohol in too much levels. She needs team behavior training. How does she give feedback to people in an appropriate way as opposed to lashing out and being angry? Anger management might be something that she could also benefit from. And then if she's going to be a teacher, maybe we should develop her teaching skills, or we decide that maybe teaching isn't her thing, patient care is her thing, and let her just go to do patient care and take the learners and put them with Vidya or Hillary, who's going to be much better teachers, right? And then looking at appropriate compensation, making sure she's got equity in her pay. Maybe that will also help offset some of the pressure of paying for her kids going to college. And then again, counseling on the substance use. On the organizational side, they are also producing, the organization that is, produces these other areas of sources of burnout that also have potential solutions. So that might be looking at the organizational mission and how do we define who teaches, who doesn't, who takes care of patients, who doesn't, why, and things like that. Team interventions and coaching. Okay, coaching can be done in team, and units should have some kind of practice activity where they understand each other. I mean, a lot of us come to work, and how many of us really delve into deepness about each individual? Sometimes we keep it pretty superficial, right? And we know a few things, maybe if they have kids or pets or something like that. But how much do we really know about people's personalities, people's motives, their values, their meaning and purpose? Because when we know those things, then we can help truly understand each other, and we as a group become a much better and more cohesive group. So if we keep it too superficial, we won't really know some of those things. And you don't have to tell everybody all of your history at work, but there's something to the value of knowing who's the introvert, who's the extrovert, who likes doing the systematic side, who likes living more free, okay? Because then we understand people, and then we can't make assumptions about people that might actually be wrong assumptions, okay? That's going to help teams be much better. And then addressing the factory-like concerns. Again, that's a good organizational leadership activity that they can come in, look at the flow, see how things are going, engage in the process of change, support the workplace environment improvements, okay? So first thing, get her an MA. Get that person back, okay? And however long that takes, shouldn't take 4 months probably, right? She could actually be ostracized or kind of pushed to the side because her behaviors, okay, and that might then delay the process of getting her help. And so we have to understand that is kind of like the dog chasing its tail, okay? And we have to interrupt that cycle and allow people to come down from their anxiety so we can pull them back on the spectrum into a better wellness place. And then their behaviors aren't going to be like that. Most of us aren't born with those bad behaviors. We do have some narcissism and things like that, but we can recognize those things, okay? But most people in general want to do good jobs. And so we want to get them to the place that we can do that. And providing those resources, again, not just for her, but for everybody in that area. Okay, so as you can see, she's got all 6 sources of burnout. They might be some higher on the individual side and some higher on the organizational side, and that's why she can't fix this problem herself, okay? We need to have buy-in, and we need to have an organization that's going to support her, okay? Okay, so then what we can see is after we identify all the problems and the potential solutions, we can start to implement those, and we can actually have better outcomes. And again, it could be for everybody. If they actually implement, on-site coaching, that would be a win-win for everyone. Okay, the salary adjustment would be a good thing. Engaging the culture together. No one wants to feel like an island unto themselves. We like community. We like being in relationship. And the more we can engage each other in relationships, the better we're going to build that culture. Okay, so any questions on that case? Did anybody write something down? Please tell me somebody wrote something down. Okay, because I want you thinking about your area, wherever it is. What are your sources? What do you as an individual have control over that you can do? What does your organization need to do? Okay? All right, and so here's my last 8 tips for creating a culture of wellness. One is leadership commitment and supportive institutional policies. We deal with distressed physicians in our unit back at Vanderbilt, and the question is why does the person with distressed behaviors stay on faculty or stay appointed in the nursing unit or whatever for years and years and years before something gets done, okay? What that does is it creates a very negative environment for the people who are still there. However, actually knowing a little bit about leadership and this process, what you don't know on the front end might be very different than what they know and are doing on the back end. And those, when they don't align, cause, again, mismatch and place for assumptions to happen. So if this was, say, a physician with really negative behaviors, started influencing the nurses' behaviors and people in the office, and that person actually gets into treatment, and this is what we do in my center, it takes time. And how many of you had the diabetic patient that changed their diet overnight? Doesn't happen. Behavior change takes time. And so that person is probably going to stay on faculty or stay in the nursing unit or stay in the lab while they're getting this treatment. And if Kerri's doing coaching, Kerri, how quick does your person turn around sometimes? Going to take a little while, right? So you got to work with them. And that's why that person doesn't get fired right away. Okay? Now, if they did something egregious, they're going to get fired. But most part, those behaviors that undermine the culture take time. We are coaching them. We're treating them kind of behind the scenes. And so what you see from your side of it is, oh, this organization doesn't do anything. They're just leaving these people in place. This is where you have to change that attitude. Okay? We'll get to that in gratitude section on the breakout. But anyway, then there's assessing the area for improvement and implementing programs and models for interventions. So again, who's paying attention to it? If we're all on the rat race and we're all on the wheel, spinning, spinning, spinning every day, but no one takes the step back to say, let me watch the flow of this procedure or this lab or this nursing unit, okay, and no one's paying attention to it, it will never get fixed. So we need to find those individuals who want to take these kind of things on. Make them your, unit wellness person or your unit whatever, professionalism person. And that individual, part of their role becomes looking at the areas for improvement and then triggering those either from the individual side or the organizational side. The next one is providing resources. And of course, that's a really important thing. Individuals, people, resources. Video, was that you last night? Who was it last night that said that when they, no, it wasn't you. Stacy, who said they had to change, when they had to change their call schedule to meet the 80-hour work rules, it actually equated to 9 new bodies that would be needed to fit that. So these few people were doing the extra work that 9 new bodies would have otherwise done. So where does that fit in your unit? Where do you need resources, people, machines, equipment, whatever it is? Those are the resources. And then the multi-level training to make sure that everyone, wherever you are on the hierarchy, has training to do what you need to do in your role, but also to take on some of this role of addressing unit changes. Okay, adding focus on the emotional and the self-regulation activities. Again, I teach this part a lot, and what I find is that most people just don't know some of this, okay? And so I don't know if you got taught about flooding and amygdala hijacking in medical school. I didn't, okay? But it's those parts about self-regulation, self-awareness that we don't always get taught. And so we need to find safe places like this to be able to do these things. Team development, again, training and or coaching, I think are really important. And then training and preparing for the challenges and provide remediation as needed. So let's get people prepared. How many of us have ever done like emergency preparedness training? Okay? Emergencies don't happen every day, but if they do, we need to know what to do about it, right? And so it's the same concept in this situation. We have to look at being prepared just in case it actually happens, and then what to do if somebody through remediation can be changed. And then role model, we can all do that, right? And we can reward professionalism. We can provide incentives when people do things really well, right? We can give them maybe benefits in their paycheck or activities in their work environment. There's a wonderful array of ways that we can actually reward and support professionalism in our work environments. And then addressing all of our sources of burnout, again, using the individual and organizational approach. Okay, so hopefully you've written something down based on your unit or yourself as an individual. So now what I'd like for you to do is take a little bit of the challenge. I asked you to reflect during this presentation And now I want you to think about defining your own role in promoting and creating a culture of professional wellness. What does that look like to you? What are the things that you can do to help promote those things? What do you do as an individual? What do you need to do in your work environment? And then think about just one thing, even if it's just one thing that you're going to do, and jot it down real quick. Okay. Thank you. Because the more likely you write something down, the more likely you will follow through on it. Imagine if every one of you in here leaves today and goes back to your individual area and does something different. Something that benefits you, something that benefits your colleagues and your team, something that benefits this institution. Because the reality is what makes up the culture of this organization? Individuals. And so the more each of us kind of get on, as I say, the wellness train, okay, then we're going to get a full train, and we're going to have whole cars that are totally supporting each other, finding ways, bless you, that are going to be able to promote a culture of wellness. Okay. So, we talked about Maslach's 6 sources of burnout. Keep those in mind because those are areas that you can identify something easily from your perspective or from the organizational approach, and then you can start to address it. Individually, we looked at the approaches that are specific to the individual's role within the organization, but our biggest strategy is about how we as individuals make up a culture. We need to have some buy-in, we need to have finances and other things that support it, but we want to think about preventing burnout and then improving our workplace culture. And I will leave you with this quote, and I will open it for questions for about 5 minutes. So think about something you wrote, and then ask a question.
What do you do in a situation where you've identified that a doctor has burnout, but they resist all attempts for intervention?
So that's an unfortunate situation, okay? The most that, if you're not in the leadership role, then empathy, support, things that I'm going to talk about for gratitude in the breakout section is really what we can try to do, being that role model. Sometimes it's what we call turning the mirror on them, okay, so that they have to see it. Sometimes people have to hear the message a couple of different times. But organizational approach to that should certainly be a process, okay? If somebody's been identified, what is the process for being able to anonymously report that? At Vanderbilt, we have what's called the Veritas system. And so anyone can actually go into the Veritas and report whether we think someone is having behaviors that undermine our culture of safety. And then those get reviewed. I think it's our nurses that review most of them. And then they take that to the team, and then the team decides what that intervention is going to be. We use the cup of coffee conversation model. And so if the behavior is kind of low-level behaviors that not going to hurt a patient or a colleague or employee, then they get the cup of coffee conversation, and somebody on a higher up level of the organization sits down and has that talk with them. We also have a very clear pathway of doing that through what we call our work-life connections at Vanderbilt, which is a part of our employees assistance program. And so that individual from that conversation then either self-reports and goes, or that individual requests strongly, dictates that they go, or that leader then takes it to their department chair or their nursing unit higher up, whoever the supervisor person is, because they have to assess fitness for duty. They have to assess whether that person is putting other people in the unit at risk, okay? And it is safer to remove them for a short period of time, get them the intervention, and then get them back into the work unit. So it's unfortunate when that happens, but there should be layers built into the system that allow the escalation to a higher level, even if you have been as empathetic as you can and as compassionate as you can in letting them know. There needs to be another process that then comes up from the organizational side.
So kind of to piggyback on that, if that person does improve, or maybe there's multiple people in an organization that are kind of dealing with this, it tends to bleed out to other people. How would you suggest dealing with the other people who are still having the issues after that person has improved? Makes sense.
That's where team coaching kind of comes in, because there needs to be a healing process there. When people have been offended, okay, one of the things I talk about in gratitude, there's this whole little process, and I won't say I'm an expert on it, but it talks about surrender, and that sometimes we have to surrender ourselves. We have to surrender the hurt feelings that we have, the anger that we have toward other people for behaviors and ways that they've treated us. All right, and so that's why a team intervention can be good. It's kind of like in the AA meeting, you have to come and you have to confess the things that you've offended other people in. And I think when you do that, then you start the healing process, okay? And in that healing process, not only does the individual who caused the problem start to heal, but those people around them start to heal.
How can you tell? I'm pretty loud. It's fine.
Okay. How can you tell the difference between burnout and a toxic work environment? Because what I'm seeing is a lot of looking at the papers or what you presented, a toxic work environment, not necessarily feeling of burnout.
Absolutely, and that's why we try to put this emphasis on the work environment, because the individual probably wasn't that way before they got into the work environment. And so those toxic work environments are the source. It's what's causing a lot of this. And you know it, we all know it. When you're in it, you know it. Okay, and so don't ignore it, but it has to be a group process. One individual can't fix it alone. Okay? All right, I think we're going to have to move on. So thank you guys. Please, 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 please take your challenge, take your activity, go back to your department, your lab, your division, your nursing unit, wherever it is, and please be the catalyst to start making change. Okay? Thank you. Oh, I'm staying. That's right.
Thank you very much, Dr. Dewey. You gave us a lot of food for thought about our individual and organizational responsibility for creating a culture of wellness here at SIU. Before we move to our breakout sessions, I did want to take this opportunity to present the AWIMS Award. So this year, our planning committee invited all members of our SIU community to nominate an individual for the inaugural SIU Medicine AWIMS Award for outstanding contributions to the advancement of women in medicine and science. The award recognizes an individual at SIU School of Medicine who exemplifies the core tenets of the AWIMS mission, including promoting positive change in the realms of gender equity, championing professional development and career advancement for women in medicine and science, supporting efforts to improve work-life integration for all, and commitment and service to the community. It is a privilege to announce this year's winner, Dr. Sangeeta Basnet. So a little bit about Dr. Basnet. She is a professor, just got promoted this year, and chief of pediatric critical care at SIU School of Medicine and medical director of the PICU at St. John's Hospital here in Springfield. She completed a 3-year fellowship in critical care at Washington University School of Medicine and a 3-year pediatric residency at Cook County Children's Hospital in Chicago. She earned her medical degree at Tribhuvan University, University of Medicine in Kathmandu, Nepal. Dr. Basnet is board certified in pediatric critical care medicine and pediatrics, and a member of the Society in Critical Care Medicine and American Academy of Pediatrics. She is keenly interested in international healthcare and has played a key role in establishing pediatric and neonatal intensive care units in her native country, Nepal. She is now leading a task force to standardize pediatric critical care in Nepal and has published and presented widely on pediatric critical care in resource-limited countries and quality improvement interventions in the pediatric ICU. Dr. Basnet's nominators, who were numerous, describe her as, quote, a guiding light. They say, quote, while she is always compassionate and kind, she has also not hesitated to push me past my comfort zone and reiterated that the sky is the limit for whatever we want to do. Further, she is described as someone who will stand up and fight for what she believes in. If something is important to her, she will not stop until she is heard. She pushes for fairness and equality. And finally, Dr. Basnet leads by example and has created a path for other women to follow. She asks tough questions, fights for what she believes in, and challenges the status quo to advance the roles of women in all areas of medical leadership. Dr. Basnet, our heartfelt thanks to you for being a phenomenal role model, a dedicated mentor, an exceptional teacher leader, and tremendous woman in medicine and science.
Thank you, Vidya. I can't express how touched I am by the kind words. I promised myself I wouldn't cry. That Gio, Dr. Capirolo, and my residents, Meredith and Kavi, wrote on the letter that they submitted to AWIMS. I must thank AWIMS, Vidya, Sue, and Wendy, and everybody in AWIMS for empowering women to do their best, to reach out for their goals and create a path for themselves, for their success. In a very short time, AWIMS has actually created a better workplace environment for women and men at SIU. There was a saying that behind every successful man, there's a woman. For me, the whole credit for what I am right now goes to two men. Excuse me. My dad, growing up in my formative years in Nepal, in a very patriarchal and male-dominated society in Nepal, did not differentiate between my brothers and me. I was very lucky. And the second person is my husband, Dr. Janakirala. The past 29 years, almost 30 years actually, he has encouraged me, not just encouraged me, actually urged me, pleaded with me, and even coaxed me not to waver from my resolve. You know, a lot of times, like everybody, I'm a little lazy, but he is and he knows it. He's my strength. You know, there were many things that I didn't want to do, but I wanted to do, and he was the one who encouraged me. Finally, I can't tell you how honored I feel to accept this inaugural award. Unbeknownst to me, they wrote it, and you considered me worthy of the award. Thank you.
Thank you so much, Dr. Basnet. So before we move to our breakouts, about a year ago, around this time, there was a lull, and I took Dr. Dewey by the hand, a bewildered Dr. Dewey by the hand, led her up to the stage, and I asked this audience a question. Whoever was here, do you remember what that question was? Do you want to dance? So I'm going to ask again. Do you want to dance?
Let's do
All
it.
right. So this year, we have the pleasure of having two dance instructors, Dr. Dewey and Dr. Smith, who are going to take us on a journey right now with the Cupid or Cupid? The Cupid Shuffle. So everybody on your feet.
Everybody stand up. All right, now I'm giving you one second or minute of overview. How many of you have done the Cupid Shuffle before? Perfect. Okay, so everybody who hasn't, watched those individuals or us up here on stage. How many of you can count to 4? All right, how many of you can count to 8? All right, then you can do the Cupid Shuffle because it's a 4-count beat for the most part, and then there's one that's an 8-count beat, or you can just say 2 4s, okay? So it's not hard. And so the basic steps are we're going to go to the right, 2, 3, 4, and then to the left, 1, 2, 3, 4. And then you're going to start with your right foot and kind of do like a heel kick down to the ground. So that's a 1 kick, and then the left is 1 kick, back to the right is a 1 kick, and so your total 4th is now back to your left foot. And then what you do, this is where we go to the 8 count, and we're going to do a quarter turn, shuffle kind of turn. So you have to kind of go right, left, 8 times. Ready? 1, 2, 3, 4, 5, 6, 7, 8. And that should result in a quarter turn. Okay? So that's pretty much how the song goes. There's a little bit of an intro, so we don't start right away. But when they start automatically to the right, to the right, to the right, to the right, to the left, right, then they'll say to the left, to the left, to the left, to the left. We're going to do exactly that. We'll go right, we'll go left, and then they'll say now kick, right? So kick, 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 and then they'll say turn it by yourself. And you'll count 8 times and you will turn it by yourself. Okay? All right, so we're going to face this way so that you can see our steps from the back. And as soon as our music is ready, all right, we're ready to go. Okay. 4 to the left. 2, 3, 4. Now kick, 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 kick. Now those 8, 2, 3, 4, 5, 6, 7, 8. Right, 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 right. To the left, 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 left. Now kick, 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 and shuffle turn. 6, 7, 8. Ready? Right, 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 right. Left, 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 left. Now kick, 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 and shuffle turn. Right, 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 right. You guys got it. Make some noise out there. Woo! Yeah, get it going. Move those shoulders. Get it going. To the right, to the right, to the right, to the right, to the left, to the left, to the left, to the left. Now kick, 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 and walk it by yourself. There you go. To the right. To the left. Now kick. And turn it by yourself. All right, take the energy out. There you go. Get that arm moving. You need upper body too. 1, 2, 3, 4. To the left. Now kick, 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 and walk it by yourself. All right. All right, S-I-U rocks. S-I-U rocks. S-I-U rocks. S-I-U rocks.
So for the breakout sessions, Dr. Dewey's breakout session on personal resilience, one gratitude at a time, will be in 4F. Dr. Palamara's Improve Your Well-Being Through Coaching, Connect, Engage, and Thrive will be in 2B. And then culinary demonstrations with Dr. Sattovia and Smith will be here in 1A. We will return to the auditorium at 11 o'clock. Thank you.